I'm Ronald Duncan. I'm chairman and CIO of Cloudbuy, so I run the board, do some of the liaison with the city, and then run all our technology. Cloudbuy provides e-commerce systems. There's two sides to e-commerce. There's helping the buyers, so we integrate with all the big buying systems. The biggest in the NHS is NHS Shared Business Service, and then we provide e-commerce sites to the suppliers or integrate with their e-commerce sites and bring the two sides together and help them trade easily.
Okay, and how was that traditionally done in the past, and how are you guys sort of innovating in that space going forward?
The big change is that traditionally people put in buy-side systems and they didn't do anything for the suppliers. And the challenge is that NHS health is complex, and so the traditional systems weren't able to deal with that complexity, so they couldn't cope with the vast array of products that suppliers had and provide rich information, because it's very important as a nurse or a clinician purchasing things, you purchase the right thing, because it has clinical outcomes. If you get the wrong thing, if you put the wrong hip joint in, clearly that's a major issue. And what we know from Darcy's work is that quite often people were having the wrong leg operated on, the wrong kidney removed, etc., etc. So when that level of mistake is being made, putting the wrong item into people is a much easier mistake to make. And so it's very important that procurement is correct from a clinical point of view, because that actually changes people's lives and stops you killing them and stops you doing things that are bad. And then it also makes it much more effective from a savings point of view if you're buying the right items at the right price.
Okay, so I mean there's a clear benefit for the patient there.
Mm-hmm.
I mean the NHS at the moment, they've sort of got a target to be paperless by 2018. Are you guys going some way to help that as well? I mean, were these sort of traditionally paper-based systems in the past?
Well, some of it's paper-based and some of it's not. So one of the things about the NHS is it actually leads the world in this area. So it was one of the first organisations to automate procurement about 40 years ago.
Okay.
So we actually have been coding up everything the NHS buys for over 40 years. So at one level, the NHS leads the world. Up until relatively recently, there was one common system that's used by the entire NHS for everything. Now all the individual trusts have got their own finance systems, and we're trying to actually get back to something where it's much more joined up. So it's gone from being quite joined up to actually getting worse, becoming more papery, and we're now putting the bits in place to actually help the NHS get back to being fully electronic again.
Okay, interesting. And you mentioned you're working a lot with suppliers. I mean, what are the challenges they're facing at the moment, sort of with shrinking budgets, and how are you guys helping with that?
Well, at the moment, one of the big challenges is that everybody wants to reduce cost. Mm-hmm. And it's, if you do it in a sort of zero-sum game, where you say you have to reduce cost supplier, that makes the suppliers less profitable, they have less money to innovate, and actually the biggest savings you get is when the supplier produces something that's better clinically, that does a better job, and quite often that can save 50% rather than sort of 1 or 2% that you're looking at in terms of procurement negotiations. And so we actually come at it in a balanced perspective, so we help the suppliers build systems, we link into their systems so that when you're ordering something, you're ordering the right item, the supplier can provide that item, they get less returns, and it makes it much easier for them to actually trade online and trade with the organisations.
Okay, so I mean, is there a big cost saving potentially for these suppliers as well as the NHS?
Yeah, you normally concede significant cost savings for suppliers. Sometimes the admin cost for a supplier can be more than the cost of the goods they're supplying. Mm-hmm. So it's very important with low value items that you've made the process seamless. The other thing that we do is we actually help them to export globally. One of the things when we actually look out across the world is that the NHS is best practice. So whilst as Brits we tend to bash the NHS, what we find is the NHS quite often pays 2/3 the price of other health systems for the same items. We also see that because the NHS started 40 years ago ordering electronically, it's got more of a sort of ground underlying structure that just makes things happen in a good way. And you quite often find in other health economies they haven't got that bit. And so whilst we're doing things that are helping to catch up, and there's a vast range of different health economies out there, there is that opportunity for suppliers, because we've done things for the university space where we've actually seen university suppliers get 10 times more business by being on the internet and having all their things available, so that people in the US, Australia, etc. can see the products and buy them. And quite often with these products, because they're very specialised, you don't have the challenges that you have as a consumer selling stuff where you put it up onto Google and you find there's 500,000 other people selling the same item and the search engine optimization is critical. With these medical things, you're quite often one of 2 or 3 people in the world that provides it, and so you come up on the front page of Google automatically with a decent e-commerce site, and that's what we're providing these suppliers to help them get out, and that makes a big difference, because selling stuff online automatically is actually a much lower cost of sale as opposed to printed catalogues, sales reps visiting and everything else that's been the traditional way of selling in the medical space.
Okay. You guys are a cloud-based system, I assume, and we're seeing an increasing appetite in central government for cloud because of things like the G Cloud, etc. How do you find the appetite in the NHS for cloud-based systems? Is there still a fear around security, and sort of what are you sort of seeing there?
Well, we've always been a cloud-based system. I mean, e-commerce is kind of, that's why quite a few of the sort of original cloud vendors came from that e-commerce space where you just had to have systems that worked all the time and were secure. We've been working in the NHS space for over 10 years now as a cloud-based system. So from our point of view, the NHS already trusts us, understands how it works and everything else. There are technical issues around about the NHS, and the NHS has got its internal N3 network, which is very strongly segregated from the internet, and we support stuff which is both sort of local cloud running on the NHS network and internet based, and helping to sort of bridge between those two systems. The NHS is now going through a stage where it's actually becoming much more open, which is going to be quite a big challenge, because historically it's been very much, there's been the N3 network and there's been the internet, and getting across that barrier has been very challenging. And we know how to do that, obviously, because we've had to help do that bridging. What we're seeing now is there's going to be another challenge coming along, which is how to do all the patient records and make them accessible, because the NHS has always regarded patient records as something that they cannot possibly ever lose or get anything wrong with. And the drive now to get patient records available so that people can write into them, that was discussed earlier this morning, is one of the biggest barriers that the NHS has got on a technical challenge basis, and it's one that we know how to work through, but it's certainly going to be an interesting debate, that one, going forward.
Where would you say the NHS is on the sort of maturity curve and getting to the point where you say they'd be sort of sophisticated in this new world of buying and procurement?
I think the NHS is quite sophisticated in its procurement. It's always been good at procurement. The challenge is to get that best practice spread out right throughout the organisation. So you usually find that in a typical trust, if you've got 100% to spend, there's somewhere between 10 and 30% that's well managed, but there's still 70% of that spend that's not yet managed best practice. Now, comparing that to other bits of government, that's usually better than any of the rest of government. So there's other bits of government where I would say that 95% of the spend is actually not visible and not managed to the level that the NHS does. So the NHS definitely leads the way. And when we benchmarked the NHS against, say, best private sector organisations, it's usually about the same place as the best in the private sector.
Okay. And the last question I've got for you is, I mean, we're sort of seeing a massive change in the NHS at the moment since the coalition government came in. Is there anything else you'd like to see coming from the government in terms that would make all of this go faster and perhaps make the NHS more innovative?
The government's pushing quite hard to do it. I think it's more within the NHS trying to make sure that the NHS does things. It's been protected from cuts in this coalition, and I suspect that in the next Parliament, because there's going to have to be a lot more savings made, no matter which party comes in, the NHS is going to have to make more changes. I think the savings are there, and there are the things that could do it, but it's going to be quite challenging, because we were talking earlier this session about 60% of a junior doctor's time being spent on admin. Now that should be automated to the point where it's down at 5 or 10%, which actually saves a lot of time for doctors and makes for better care. The challenge you quite often find when you put in IT systems is that you find managers putting in, oh, it's really easy to create forms, let's create another 10. And whilst we can automatically generate forms and everything else for people, it's very important that you minimize them and just make sure that you're creating sensible data collection rather than going, oh, it's easy, let's collect more.
Okay, brilliant. Thanks very much, Ronald.